In recent days, the new Health and Human Services Secretary, RFK Jr., made remarks saying that SSRIs are a danger to children and harder to get off of than heroin. Now, SSRIs are selective serotonin reuptake inhibitors such as Lexapro, Zoloft, Prozac, among others, often used to treat anxiety and depression. I'm joined by Dr. Louise Villaplana, Chief Medical Officer with Meridian Health Care. Doctor, thanks so much for being with us.
Thank you for having us.
So first off, what are SSRIs and why do doctors prescribe them to children and adults to help them?
SSRIs are antidepressants, and they've been around, for example, Prozac, one of our first ones, since about 31 years ago. They have been in use for that long, and they've been extremely effective in the treatment of adult depression, PTSD, issues with anxiety disorder, as well as obsessive compulsive disorders. In the adolescent population, in the pediatric population, so to speak, it's a little bit trickier because we have pros and cons, and it's really difficult to delineate when we're stepping outside of the bounds of safety and when we're incurring into increased risk for those children.
And based on your experience, what are the dangers of potentially taking these drugs away?
These drugs have an acute phase of treatment. They have a treatment phase where we are just contemplating whether we need to change the dose, increase it, change the type of SSRI, and then a maintenance treatment. In most cases, we like to see at least a year's worth of treatment and then start thinking about tapering these medications. These are not the kind of medications that you should stop suddenly.
And is there any evidence out there that shows SSRIs are a danger or comparable to getting off of a drug like heroin?
Well, in adolescents, if you take any adolescent, they have about a 20% risk of developing a major depressive disorder during this age. Particularly at the beginning of treatment, these drugs can increase the risk of suicide attempts or suicidal thoughts. And this is the time where the care team, which again involves the provider, the patient, and parents, as well as therapists, have to come up with a decision as to whether SSRIs is a treatment of choice at this point in time in their disease process. Back in 2004, the FDA commissioned a study looking at the safety and whether we had enough data that these medications were actually more efficacious than risky. And that's where the problem is. In adults, we have plenty of studies, and children, not as much. So, of course, this is a very susceptible population, and we want to make sure that safety is our number one concern. And clearly, that's what we got our treatment based on.
And do you feel like it would be the right move to say, to take these drugs off the market if that were something that they tried to do? Or do you feel like for adults as well, the pros outweigh the cons? Although you mentioned, there could be more research on children.
In adolescence, I don't think we'll ever feel comfortable unless there's something that tells us that there's no question about it. But if you put a patient on an SSRI at that age, typically you have about a 14% increase during the initial phase of treatment for suicide ideations or suicidal behaviors. That's a scary component of the treatment, and that's probably the one time where we have to watch them very carefully. So again, this is a care team approach where everybody, all hands on deck, because this population is extremely dangerous. And at no point in time, whether they're adolescents or they're adults, should a medication like this that has been instituted, particularly if it's effective, should be stopped suddenly.
All right. Well, thank you so much, Doctor. We appreciate your time.
My pleasure. Thank you.